Welcome to Benita's Maternity Program webinar. Today we'll be chatting with Sister Ingrid on stem storing. Welcome, Sister Ingrid.
Thank you very much. I'm happy to be with you here again today. And today, again, is a very exciting topic, and a topic that I think people are, it's quite needed that people are aware of stem cell storing. So perhaps this is the first time that you hear about stem cells, or you might have heard it, or perhaps you already researched a little bit on it and you are already planning to do this. So perhaps let's start at the beginning. I'm going to go through some questions, and these questions will actually guide you and explain to you as to what exactly am I talking about. So like I said before, we are talking about stem cell storing or storage of for your baby. Okay, so this is a decision that you need to make in your pregnancy so that certain things can happen at birth. Okay, so let's start with the first thing. What on earth are stem cells? This is something that a lot of people ask. They might have never heard of it. So just to explain to you in short, stem cells are the original building blocks of life. Okay, so these little stem cells, those are little cells that are present in the cord blood, and these cells can actually differentiate into all sorts of specialized cells. So it's almost like a little magical cell that can become whatever one wants it to become. So it is basically, if one thinks skin, blood cells, muscle, bones, nerves, all these things, you get these, and they can actually differentiate into those kind of cells. Okay, so where are they found? And I just brought my baby and the placenta and the cord just to show you and just to explain again what happens inside your body at the moment. Being pregnant, your baby is in the uterus, and your baby gets all the nutrients and the oxygen and everything that the baby needs through the placenta. The placenta is actually, it's basically at the inside of the uterus where it is attached, and the baby then is in here. So if one thinks what is happening in the cord and what is happening in the placenta itself, there is cord blood going to the baby and then going away from the baby. This is a continuous process, and in this the baby gets all the oxygen and the nutrients and so on. But it's also important to note that in these veins, or in these, in the cord itself, you have, in the cord blood, you've got the stem cells. And that is where the stem cells are. It is quite a lot. It's an abundant supply. It is a huge amount of stem cells that one can get from the cord itself. This is the only time in your life that you can get so many stem cells at once. It is important also to remember that it can also, it's something that you can get later in life, but it takes a far longer time period to actually get a certain amount of stem cells. So at birth, in the cord blood itself, so in this part here, that is where a lot of stem cells are situated. So that is where you actually get it from. So how is it then collected? So if you now decide, okay, I want this done, I want my stem cells or my baby stem cells collected, how exactly is this done? Okay, so perhaps you have in your life at some point donated blood. So it's very much the same kind of principle. It's very easy to do this. It's just important, you cannot decide at birth to do this. This is something that you have to decide beforehand, and I'm going to give you some more information on that. But you will get a kit, and all this goes with you to the hospital, or that you have with you at your birth if it's a home birth, so that the midwife or the doctor can actually do this directly after birth. It is a little tube with a little bag and a little needle, like if you donate blood, and it is basically directly after birth. The cord itself is clamped, and you have that it actually goes into the cord itself, and then the blood in the cord goes and it collects into the little storage bag, or it goes into the bag. So it's a very easy process, and this is where they get it and how it is being collected. Now the question is, does it change anything at the birth? if you do collect your baby stem cells, will it be any kind of different as to how the birth normally would take place? And the simple answer here is not really. It depends on where you will have your baby. It's very common nowadays to start to think about delayed cord clamping. So there's quite a big movement to say, you know, try to keep the cord attached to baby, pulsating to baby for a longer time period. And this is the only thing that would change. So it's not a situation where you can say the baby's born and then one waits for 10 minutes or so before it stops pulsating and then to try to get the blood out, because by that time everything has been given back to baby. So in a situation where you want to store the cord's blood, the cord has to be clamped fairly quick after birth. You have perhaps a couple of seconds or a minute or two just to see that baby is okay. If you see everything's fine, clamping the cord, and then that blood that remains in the cord then goes into this little storage bag. The longer you wait before this is started, the less the likelihood that enough of this blood will be collected. So that is the only thing to think about. So it is quite common, it's quite an easy process. It's just important to know that that your midwife or your doctor is aware that this is something that you want and that you're coming with the kit of the stem cell storing kit. Okay, so what illnesses, and then that's perhaps the biggest question as to why would you do this? Why would you do stem cell storing? You know, what is the reason for that? You know, if we talk about this, and the biggest reason is that it can definitely help to treat a lot of illnesses nowadays. Now, first of all, we have to look at and remember that there are two things that are stored. You have the cord blood that is in the cord that is collected. Now that is being stored, and then also cord tissue, that a piece of this cord is being cut and that is basically placed in a little tube, and that's also sent off because it has different kinds of cells. Okay, so if we think about the cord itself, not the cord, but let's start with the cord blood itself. The cord blood actually helps to really treat a lot of different diseases. It's more than 80 kind of blood-related diseases that can be treated, and some of the most common ones are bone marrow, bone marrow cancers like leukemia and so on, that can be treated with stem cells. Certain kinds of anemia, immune deficiency disorders, and all sorts of inborn errors of the metabolism. So there are lots of different things currently already treated with stem cells. Now we also have to add here that internationally there are a lot of research, or there's a lot of research being done currently, and they're even now trying to work on cerebral palsy, type 1 diabetes, brain injuries, strokes, aneurysms, autoimmune diseases, and all sorts of other things that can actually, other illnesses and so on that are currently being, worked on, or they're doing research on that, and it looks very promising. So as time goes by, more and more illnesses are being able to be treated with stem cells. So it is really a kind of treatment that one can think about, if you think about how this actually then works. So that is from the cord blood. Now the cord tissue, and what I mean with that is the actual cord itself, the cells that actually make up of the cord itself, that also has some really interesting and unique cells. And they are capable of differentiating into many different types of cells, as well as powerful anti-inflammatory properties. And a lot of things that are treated here with these cells are like skeletal injuries, autoimmune diseases again, heart and vascular diseases, gastrointestinal diseases, diabetes, neurological diseases, wound healing, transplant complications that might have occurred at some point, and then also cosmetic uses. So if one has, if you think about the cord blood and the stem cells in the cord itself, one can really see that there are lots and lots of different kind of things that can be treated with that. And that is really the reason why a lot of people basically start to look at something. So who can use it? You know, so if you have basically stored the stem cells of your baby, who can actually use this? Now, it's important to realize here that it is a 100% match to your baby. Okay, so it is the baby's own stem cells. So the body will definitely 100% take those stem cells later in life if needed. Okay, so it is not like currently if one needs bone marrow, for example, with such certain cancers, you have to find a match and then one hopes that it actually will work. Where here, one knows it will because it is a 100% match to that specific baby. So for that baby whose stem cells you have basically stored, that will be a match to your baby. It is also, however, important to realize that if for siblings, so for other siblings in the family, it is also a fairly big possibility to use. It's about 1 in 4 chance that it can be used, okay? And even for other family members, or then also for parents and so on, it becomes smaller, but it's still a very viable option to look at. So in a family, so if one thinks now, who has to do this? Any kind of or any family where there are a lot of illnesses or diseases currently present, it is something to potentially look at. Another thing to consider here is that if how likely is it going to be for your baby to find a match? And in a lot of cases, perhaps the match might be fairly easy to find. But nowadays, with cross-racial relationships and babies born, it sometimes is a little bit more of a tricky thing that baby might find it very difficult to find an exact match for that baby. And that is the reason why a lot of times it will be referred to say, you know what, think about what about stem cell harvesting and storing for your baby. It's almost seen like an insurance. So it's something that you have, that you could use should you need it. You hope that you never do, but should you need it, you actually have that possibility to use it. Okay, so if we think about all these illnesses, it can be treated with stem cells. And the stem cells you get in the cord blood, and then also some of the stem cells are also found in the cord itself, and all these stem cells can actually do something. So it is being stored, and it's being stored for a very long time under extremely cold circumstances, or the environment itself. So it's not something that will defrost at any point or so on. So I don't think we need to worry about that. Okay, so if one thinks how to do this, so if you sit here and you think, you know what, that definitely might be an option for you, then perhaps it would be to try to get some more information. And if you just Google stem cell storage in South Africa, there are a couple of companies that actually do this, where you can get some more information, where you can get the kit, and then that kit stays with you. It is not something that will be left in a hospital so that when you come that it's available for you, because perhaps by the time you arrive at the hospital, nobody knows where this kit is. So it's always better that the client itself keeps the kit, so that later on, if you are in labor and you go to hospital or wherever you're going to have your baby, is that it is available at that time and it can actually then be used. Okay, so it's a very easy process. Just to recap again, the reason why we do this, or that there's an option for you, I think it's important to realize that everybody has an option to do this. Obviously, there are some costs involved, and even at the different companies, this is where you need to find out how much and how exactly it works. But the working of it is fairly similar, in the sense that you apply for it, you get the box, the kit basically, that is being done then at birth. So the cord blood itself goes into a little storage bag that is couriered to the company, they check that all is in order and it's enough of that, and then it's being kept then for that specific family. Also important to know, it will never be tested for someone else. So if another family is looking for a potential donor, it's never going to be an option to look at your stem cells or your baby's stem cells, because that is exclusive for that baby or that family. It will not be tested for somebody else. Okay, so that is another thing that a lot of times people do ask. So yeah, so it is something that is available. If you need to find out some more information, Google stem cell stories in South Africa and get some more information on that specific, you know, that company. But like I said, it's very easy to do. It's not difficult. It's just important that your doctor or your midwife is aware of that this is what you want to do, because it does change the birth a little bit as to, you know, the clamping of the cord. One needs to clamp fairly quickly to have enough blood left in the cord itself so that that then can be stored. Okay, so I hope that told you a little bit more about stem cell storing. And it's been done for a long time already. It's been done from about 2010, if not even before, where it started. So by this time, you know, it's more than 10 years already that it's really something that's ongoing, and more people are aware of it, and more people request and do this, because it is a viable option potentially for the future, so that if something happens to your family or to your baby, that this is an option for treatment.